Hi. So you've received your hormone replacement prescription. My name is Grace Meehan, and I'm a pharmacist, and I'm also a certified menopause practitioner with the Menopause Society. And I'd just like to go over some counseling tips for you so that you can get the best effect out of your hormone prescription. Let's start with estrogen. Now, if you've received your prescription for estrogen, you're going to notice that it's in a topical or also, as we call, transdermal form. And you might be wondering, how come I'm not taking it in a tablet? So many products and medications are available in tablet form. Well, what we know about estrogen that's very important is that it has a really favorable health benefit when it's used through the skin rather than taken orally. For instance, if we take an oral estrogen tablet, it does these things. It can increase your risk of clotting. It can increase a bad cholesterol level called triglycerides, and we don't want that. That's unfavorable. Oral estrogen tablets can also increase your inflammation in your body, and we see that with elevated C-reactive protein. When we take estrogen orally, it can also increase sex hormone binding globulin, which has a negative effect on our libido, whereas transdermal estrogen does not do that. Also, oral estrogen has to be swallowed, goes through the stomach, then passes through the liver. That's called the first pass effect through the liver. And what that means is that the estrogen isn't available immediately for its good effect. It also means that oral estrogen tends to need a higher dose than the transdermal or topical estrogen does. The topical estrogen has more steady absorption, so your hormone levels are more constant, and that's a benefit as well. Now, it's important to know that your prescriber prescribed your estrogen product specifically for your symptoms. But what we do know about estrogen's effects, it has lots of favorable effects. It's the best thing to use for hot flashes and night sweats. It has a very positive effect on our bones, so can prevent osteoporosis. When we take estrogen orally, it can also increase sex hormone binding globulin, which has a negative effect on our libido, whereas transdermal estrogen does not do that. Also, oral estrogen has to be swallowed, goes through the stomach, then passes through the liver. That's called the first pass effect through the liver. And what that means is that the estrogen isn't available immediately for its good effect. It also means that oral estrogen tends to need a higher dose than the transdermal or topical estrogen does. The topical estrogen has more steady absorption, so your hormone levels are more constant, and that's a benefit as well. Your prescriber prescribed estrogen for your specific symptoms, but it's important to know that it has many favorable effects in the body. It's the number one treatment for hot flashes and night sweats. It's very helpful for bone health, so it can prevent osteoporosis. It's important for our vaginal and urogenital health as well, and our cardiovascular health. It also has many auxiliary benefits as well. For instance, it helps muscle and joint pain, even our skin, our hair, and helps brain fog. All of those things. Let's talk about how to apply your estrogen product now. Here are 3 key points before you apply. Number 1, always read your prescription label so you know your dose. Number 2, because it's being applied through the skin, you're going to wash your hands. And number 3, it's going to be applied to a clean, dry area of skin that's intact. In other words, no cuts, scrapes, or abrasions, because applying to that would alter the absorption and possibly cause some skin irritation. Let's talk about how to apply your compounded estrogen product. Compounded estrogen is going to be applied, again, to clean, dry, intact areas of skin. And the best place to apply is going to be the thin skin of the inner arm or the thin skin of the inner thigh. Now, there are different devices that your product can be put into. Typically, a pump, which is a metered dose pump, is used. If you're using metered dose pump, again, read your prescription label so you know your dose. The very first time that you use the pump, remove the lid and give a few squirts until you see the cream come out. That's called priming the pump. Then you squirt the cream onto your hand and apply either to the inner arm or to the inner thigh. give it a really good rub in with this one. So you're going to rub until you don't see any cream residue left on the skin. Give it a chance to dry, then you can put your clothes back on. Please do not bathe, shower, or swim within an hour of applying your cream. Wash your hands after application. It's also best to avoid skin-to-skin contact with another person or with a pet. Your prescriber or you may have chosen a different device for your compounded estrogen cream. There's also this device, which is called a Topi-Click. To use a Topi-Click, first remove the lid, read your prescription label so you know how many clicks that you'll be applying. I'll demonstrate if you were to use one click. You would just simply hold the device, turn the base so that you see the cream, and then you apply it to your skin. Again, because this is compounded estrogen, you're going to apply it to the thin skin of the inner arm or the inner thigh and give it a good rub in until you don't see any residue left. Put the cap back on your product. Wash your hands once you're finished. And again, wait at least an hour before you bathe, shower, or bath. It may be that either your prescriber or you chose this way. How to use this? Number one, read your prescription label first so you know how many mils of cream you're going to apply. Take the top off the pot and set the pot down on the table. I'm going to say my dose was, say, 0.5 of a milliliter. What I'm going to do is I'm going to pull the plunger of the syringe down to the 0.5 mark. Then I'm going to insert this into the hole of the pot and push that 0.5 mils of air in. This is important now. Remove the plunger. Put the plunger back into the product and push to get that 0.5 mils up. Now I've overshot, and that's okay. I'm going to put the plunger back in and push it down to the 0.5 mil mark, and now I'm ready to go. Remove the syringe from the pot, and you can apply it to the thin skin of the inner arm, inner thigh, or back of knee, and give it a good rub in, leaving no real cream residue on the skin. Okay, a really good rub in. Wash your hands well and put the top back on the product. And this is to be kept at room temperature. Let's talk about the commercial estrogen product that you may have been prescribed. We'll start with the patch first. The estrogen patch is applied to 3 different areas of skin as an option. One would be the lower abdomen, just underneath where your underwear would be. It can also be applied to the buttock, or it can be applied to the thigh. Before you apply your estrogen patch, read your prescription label first so you know your instructions. Wash your hands first before you apply. You take it out of the package, tear this, take the patch out, and when you're ready to apply, you're going to make sure that you're applying to a clean, dry, intact area of skin, and especially be sure that there's been no moisturizer on that area of skin. Otherwise, the adhesive of the patch just will not work. When you're ready to apply, take the back off the patch and apply to the area. Say I'm applying it to my abdomen right now. Give it a press against the abdomen for a full 10 seconds so you can be sure that the adhesive will apply well. After you've done that, wash your hands. With the patch on, you are able to swim, bathe, or shower with it. So no worries in that regard. Now, if you are ready for your next dose of patch, what you want to do is remove the current patch first, roll it together so the adhesive sticks, and then dispose in the garbage. Then you're ready to apply your next patch. For your next patch, use a different area of skin than you had just used so that your skin can breathe and not be irritated. You may have been prescribed estrogen as a gel in either a pump form or in a little sachet form. When you go to use your estrogen gel, be sure to read your prescription label first. The gel is applied in a couple different spots. It can be applied to the inner thigh, or it can be applied to the arm, from the shoulder down to the wrist. Again, be sure that the skin is clean, dry, and intact. With the pump, the very first time you use it, you need to prime it, meaning give it a little squirt until you see the gel come out. Then you're ready to go. Put your dose in your hand and give it just a couple of swipes. The gel does not need to be rubbed into the skin until it disappears because it dries very quickly. Give it a time to dry, about 1 or 2 minutes. Wash your hands well, and you're good to go. The same goes with the sachet. Read your instructions on your label. You'll tear open the sachet, put your dose on, again, either the inner thigh or the arm from the shoulders down. Give it a good rub. That's it. It will dry, and then you can put your clothes back on. Avoid swimming, bathing, showering for at least an hour after you've applied the gel. And again, avoid skin-to-skin contact with someone else or a pet for at least 4 hours. When should you apply your estrogen product? Generally, we tell people to apply it in the morning, but it's not a really hard rule. If you prefer to apply it at a different time of day, that's absolutely fine. The key is to try to be consistent to keep your hormone levels more consistent as well. What should you do if you forget a dose? It's very simple. Once you remember that you've forgotten the dose, apply it as soon as you remember. If it gets to the point where you're ready for your next dose, though, please do not double up the dose. Generally, estrogen replacement is well tolerated, but like anything, there can be some side effects. Skin irritation may occur. If that happens, just be sure that you have rotated your site of application. In other words, don't use the same patch of skin over and over because the skin can get irritated. If you do notice skin irritation that's not going away with rotating, let your pharmacist or your prescriber know. Other possible side effects with estrogen, there may be some breast tenderness, there can be some headache, sometimes some mood changes. Things that you may want to report to your prescriber. Rare side effect. If you experience any pain, swelling, kind of a hot spot behind your leg, that could be a warning sign. Again, very rare, but something to seek medical attention for. In women who are using estrogen postmenopausally in conjunction with progesterone, may experience some spotting or bleeding in the first few months of using estrogen and progesterone together. That's very normal. Nothing to really be worried about. But if you've been using estrogen and progesterone together for months and all of a sudden you have a bleed or a breakthrough bleed, then report it to your prescriber for evaluation. If you have any other questions about something you may be experiencing or just general questions at all, our pharmacy team is there to answer for you. So give us a call and we'd be happy to help. And finally, congratulations on taking care of your menopausal health.